Good evening. Welcome to BMC Global Live AL-HILAL Health World. Nothing but lifestyle. Myself, Marina Francis. So here we are back again in yet another episode of Health World, taking little steps towards creating a healthy world. So friends, we always say that today's growing children are the future of our world, the young generation. And getting back a healthy world is very much possible. For a healthy world, for a healthy population, we must ensure that our growing children grow in a healthy manner. We are right now in a situation where we are locked up in many ways, many restrictions. We have many challenges that we are facing. Even after the pandemic gets over, we may have new challenges. But at all times, ensuring the well-being of children will always be our top priority. So today we have with us a pediatrician to talk to us about various aspects regarding a child's health. With great joy, with great happiness, I welcome Dr. Abuzer Surka, consultant and head of the Department of Pediatrics at Al-HILAL Hospital and Medical Center. He has a vast experience of 27 years, a very apt person for us to have with us today. Completed MBBS and MD in Pediatrics from Gujarat University, who has an expertise in treating all types of allergies, neonatal problems, child nutrition, respiratory problems in children, health defects and newborn screening. He is available currently at Al-HILAL Hospital, Muharraq branch. Definitely, we can hear many important aspects from doctor today, so let's hear more from him. Good evening, doctor.
Hello, good evening.
Welcome to Al-HILAL Health World.
Thank you so much.
Thank you for joining with us, doctor.
Thank you for inviting me to share my experiences for the betterment of child health.
Yes, doctor. Doctor, we heard that you have an expertise in allergies. So allergies in children is something that is difficult to handle. So first, let me ask you, what are the different types of allergies seen in children?
This is a very much important question as regarding child health. Basically in children, there are 4 types of allergies, which we see commonly in our clinical practice and which has been documented in the literature. First of all is the skin allergies in children, which we know as childhood dermatitis, which commonly presents as skin rash. And the child is almost very much irritable, cranky and crying in the younger age. Yes. After that, the child develops symptoms of itching. Second common is the food allergies, which we encounter in children after 6 months of age when we start to introduce the different types of food to the child. Yes. Third, which we see in the neonatal period, which is a newborn period in the first 6 months of age. That is known as the milk allergy or more commonly as cow's milk protein allergy. This is particularly related to the milk protein. Because as we know, in the first 6 months, the only food or only diet the child takes is the milk, whether it be the mother's milk or the formula milk. And last and most important and very commonly seen after 2 years of age is the respiratory allergy or the frequent cough, cold and the breathlessness. This will come as these symptoms. The child may come sometimes in an emergency with severe breathlessness, or the mother may be really trouble due to frequent episodes of cough and cold, especially when there is a change in the season. And this is particularly common in Bahrain, because as we know in Bahrain, this weather is so much predictable. So because of that, there is a frequently changing climate, and it is very much specialized to Bahrain that we can see all the three seasons in one day. True. Many times. Yes, so because of that, the kids who have got allergies, they suffer a lot and they have these episodes of respiratory allergy.
Yes, doctor. Doctor, when a child comes with symptoms of allergies, how do we diagnose what allergy it is?
Yeah, of course. So it is very important to take a proper history from the parents, because as we know, the child is always unable to tell his or her complaints. The child will not be able to explain to us. So it is very important that the mother or the primary caretaker should be present when the child is coming to our clinic, so that we get to know the actual condition when the child has the allergic symptoms. Because many a times it happens that when the child is coming to our clinic, the child may not have the symptoms at that particular time. Child may have had the symptoms at home. Yes. And at that time we need to know exactly from the mother that what sort of symptoms the child had. So, for example, if it is a skin allergy, the mother may tell us that the child had a severe skin rash, which actually subsided by the time they came to the clinic. What was the character of the skin rash? Many a times the parents are very much alert, and they will bring us the photographs of the skin rash. From that, we can come to know.
Yes.
If the child has an active skin rash at the time of presentation, it is easier for us to diagnose, because the diagnosis of childhood dermatitis depends upon the type of the skin rash, where is the skin rash located, on which side of the body,
Okay.
and are there any other associated symptoms.
Okay.
Associated symptoms means that for a younger child, the child may be irritable, crying too much. Child may not be feeding properly because of the discomfort with the skin rash. Then comes the older child, may be constantly itching. There may be itch marks because of the nails, and then we can make out from that the child has severe itching and child is not able to sleep properly at night.
Yes.
Thirdly is the, as I told, the site of the skin rash.
Okay.
Now the site, it is as I would like to share with you that the childhood dermatitis are also of different different types. One of them is also known as the atopic dermatitis, which is a very severe form. Now this atopic dermatitis usually happens on the flexural surface, means where we fold our hands and arms, like in the gap of the elbow, like the cubital fossa, or just behind the knee, which is also known as the popliteal fossa. These are the places where commonly we see the skin rash of atopic dermatitis. Another important type is a diaper dermatitis, which is usually seen in the kids less than 1 year of age, where the skin rash, sometimes very severe, very red, and totally sometimes it may get also secondarily infected. But it is primarily restricted only to the diaper area.
Okay.
So that is also very much troublesome for the baby as well as the mother, because whenever the child passes the urine or the stool, it gives immense pain to the child and the child may cry incessantly.
Yes.
So it is very important to take a proper history, and then comes the examination to reach the diagnosis. So as I told you that the clinician, the pediatrician, they will examine the child thoroughly all over the body. Sometimes we may come out with other skin rashes which the mother may not have noticed. So it is very important to check and examine the child properly. After the history and the clinical examination, we reach to a diagnosis, or we need to confirm the diagnosis precisely. So for that we take the support of the laboratory test. Now which laboratory test would give us the diagnosis? That would be the next question which comes to our mind. So per se there is no gold standard, or there is no 100% confirmatory test. But we have got certain supportive tests which help us and guide us to reach the final diagnosis. Of this, there is a certain cell counts in the blood, and there are certain immunoglobulins which are specific to the allergic conditions. The immunoglobulins, there are certain proteins in the blood, and they are of different types like A, G, M, and E. So depending upon that, and from our experience, we advise the test depending upon the type of allergy. And from the levels of the immunoglobulin in the blood, we reach a diagnosis that the child is hypersensitive, the child is allergic.
Okay.
Now, allergy, what it is actually? Why? What do you mean by allergy? That is what common person thinks that what we see the symptoms, but what happens inside the blood? Why the symptoms occur? So there are certain allergic elements in the blood. What do you mean by allergic elements? Means they react to the antigen exposure. Antigen means any foreign particle which the body is not accustomed to. Now there are so many things involved in getting a particular sign or symptom. There are so many elements inside the blood. To name a few, there are blood cells like eosinophils, macrophages, monocytes. There are also immunoglobulins. They all come into play.
Okay.
And depending upon the type of allergy, the severity of the allergic response, and the status of the child's immune system, all these together play a role in deciding that what will be the severity of the symptoms and signs, and where the signs will appear in the body.
Yes.
So to reach a final diagnosis, in short, we need to take a detailed history, proper clinical examination, and a supportive laboratory test.
Okay.
And from this we can reach a proper diagnosis, a final diagnosis, whether the child needs any specific anti-allergic medication or not, or is this allergy a passing phase and it will go away.
Doctor, you explained about skin allergy, the different kinds of skin allergy and all. And I see that in younger kids, there are some kind of skin allergy that may develop, and when they grow up, it may subside. So, according to the age, is there a difference in the allergic symptoms that the children show?
See, as I told you just now, that allergy is a combined effect of certain factors in the body. Now, this is also directly connected to our immune system.
Okay.
So, this is commonly seen, and many times parents come to us or some doctors advise them that this allergy will go away when the child is 5 years of age. Very commonly, I hear from my patients over these years. It is not, there is, first of all, let me tell you, there is no cutoff age that 5 years or 7 years or something like that. It all depends upon the child's immune system. Again, as we saw that it is the several factors in the immune system which work to decide the severity of the allergy and the type of allergy.
Okay.
So now it all depends upon the child's immune system, how strong the child is, how strong is the immunity. So it happens in some cases that the allergy may gradually decrease and may go away by 5 to 7 years of age.
Yes.
So, but it is not a norm. It is not a thing that it happens in all the children. Many children of allergic rhinitis, I would like to tell you, or allergic dermatitis, may develop after several years into allergic bronchitis. I would like to share one important thing, that all these allergies are also connected. Okay. It has been proved by study and research that allergic dermatitis is connected to allergic rhinitis. Rhinitis means frequent sneezing and running nose. Okay. Now, those kids who have a history of frequent running nose or sneezing in younger age group, when they were less than 5 years of age, they go on to develop allergic dermatitis. The exact correlation is not been established or not been known why, but it has been seen in so many studies and research that these two are connected. So it is always prudent to diagnose an allergy as early as possible, and if possible, if it is severe, treat it in the early stage, so it will not progress to the another form and it may not harm your child.
Yes.
Another important thing is that what is bronchial asthma? Asthma is one type of allergy. Yeah. So those kids who have got respiratory allergy in the younger age group, they may sometimes, not all, but may sometimes develop bronchial asthma. Okay. So as coming back to your question, that allergy subsides over a certain period of time or over several years is not always true. So always don't take it for granted. Consult a doctor if your child is suffering. Don't let a child suffer so much. Let us reach a proper diagnosis and then we can decide.
Yes. Doctor, next question is skin allergy, respiratory allergy. You dealt with few aspects regarding that. Another main problem in children is food allergy. Some food is not suitable for all children. Yes. So how do we understand which food is causing allergy for the children and how to cope with that situation?
True. So now the food allergy is also, we can divide into two parts. One is in the younger age group, as I told before, which is a cow's milk protein allergy, because the main food in that age is the milk. And second is the, general food allergy, which the child has to any sort of food. Now first I will talk in short about the cow's milk protein allergy. Okay. Now what is cow's milk protein allergy? As the name itself says, it is an allergy to the cow's milk protein. There is a specific protein in the milk, and some children are born with this allergy to that protein. Okay. So how they will present? Now suppose there is a newborn child, how you will know that the child is having allergy? Yes. So common symptoms that come to us is that the child is constantly crying, child is having frequent colic, and there are stomach disturbances like constipation or loose motions. Okay. These are the basic symptoms that a newborn child may face if the child is having cow's milk protein allergy. Okay. So it does not mean again that all babies with these symptoms are having allergy. But if these symptoms are frequent, persistent, and they are not going away even by normal medicines for colic or for vomiting, then we have to keep in mind that the child may be having cow's milk protein allergy. Okay. Also, another important aspect to be known in the history is whether there was any family history of allergy. Any of the siblings, any of the parents, if they had any history of allergy, it is more likelihood that the newborn baby may have allergy. So we need to diagnose this, and we need to give a special formula. Specific formula is there for cow's milk protein allergy. which is thankfully available in Bahrain always. And those child who are having cow's milk protein allergy will only tolerate that particular formula feed. Even the mother's milk contains this specific protein. So it is very important that we need to reach a diagnosis. How do we know? So to reach a diagnosis of this cow's milk protein allergy, as I told you, there are certain blood tests like immunoglobulins to first of all establish that the child is allergic, and then there are specific tests for the food allergy. In Hilal, in Muharraq, I am doing it for so many babies, and we have been able to reach a diagnosis, thankfully, and many babies, and they have been really satisfied because we have that facility to do that test for diagnosis specifically cow's milk protein allergy. There is a food allergy panel in which we test again the specific antigens, and we come to know that the child is having this allergy to this protein. Because small baby is always difficult to treat, and it is also much more sentimental for the entire family, because child is crying at night, not feeding well, or after feeding having the symptoms of vomiting. Obviously we all will get worried. So this is how we reach a diagnosis to know that the child is allergic, baby is allergic to this protein, cow's milk. Now regarding other foods, as you told me, how we can know. So after the child is 6 months of age, when you are starting to introduce certain food, now there are two ways to diagnose this. First and the most short way is to trial and error method. Means once you introduce certain food and the mother comes to know that, for example, if the child is having egg allergy, then you are given the little amount of egg to the child, then the child may develop symptoms of allergy. So you come to know that my child is not tolerating this food. This is one method. And another, if after one particular food, if you find the child is allergic, there is very high chance that the child may be allergic to other types of food also. So always when you come to know that your child is allergic to one particular food, then better go for the food allergy panel test, so that the child doesn't suffer with other food also. From my experience of this 2.5 decades, I would like to share that there are certain food groups which are highly allergic. These are the dairy products. Secondly, the nuts, all types of nuts, peanuts and all. And then very important also seafood, fish and all. These three are the commonest food items which a child may be allergic to. Less commonly are the fruits and vegetables and meat and poultry. These are the less allergic items, but most commonly is this three food groups. So always whenever you feel or you have a doubt that my child may be allergic to these things, better you go you consult a doctor who has got experience in allergies. Because many times certain doctors, they don't have experience, they don't advise, and then we miss the diagnosis. We don't want to miss the diagnosis, because we need to reach to a proper diagnosis regarding food allergy as early as possible.
Doctor, even how to cope with that aspect also, because if there is an allergy for the child for maybe a protein food, so the nutrition that the child must get from that food might also be lacking. So how to cope with such situations?
Yeah. See, first of all, priority is that we don't want allergic symptoms in the child, right? So for the time being, when we come to know that my child is allergic to a particular food, first thing is we have to stop the food. Now next step comes, as you told me, that for example, it is dairy products. So my child will be devoid of calcium and protein which are so much abundant in the milk and dairy products. But we should be thankful to nature for that, because nature has provided us with many other sources also. And simultaneously, we have to treat the allergy. The good news is that the allergy can be treated. So we have to treat the allergy by proper medications, and over a certain of time, once the doctor feels that the child has been the allergy in the child has been suppressed, and allergy is being come under control, we can slowly introduce small amounts of the food which the child was allergic to previously. And we can again see, and if the child is tolerating well after the medications and after the allergy is under control, then we are coming back to normal. So for example, I will like to tell you in short about milk, that what to do when the child is allergic to milk, what you can give. So first of all, there is a hypoallergenic milk formulas available, which contain the specific nutrients which are also in the milk, but they don't contain the allergic components. Secondly, there are also other sources of calcium which you can give to the child. There are certain vegetables, like for example, the drumsticks. The drumsticks have got very good amount of calcium. Many people don't know about it, and it is a good source of calcium. You can give the soup to the child, and the child will get calcium. Sometimes the child is allergic to particular protein in the milk only. You can try to give cheese. Child may not be allergic. So cheese is also very good source. Regarding the protein, there are other sources of protein we can give. There are certain pulses are there, and there are also eggs if the child is not allergic to eggs. So we have to find the ways and means. But don't ever expose the child to the same allergic food if you know that the child is having. Don't think that one time or two times he had, so maybe now it is okay. No, allergy doesn't go away like that. So we have to give some time, and we have to desensitize the child, and then only we can be sure. Otherwise, the symptoms may even aggravate the next time or the after that. And that may sometimes put the child's life in danger. Allergy is not always mild. Some cases, very few cases, allergy may be also severe. So we should keep that in mind.
Okay, doctor. Doctor, while talking about nutrition, one common question that parents ask is that are with vitamin tablets or food supplements, something like that, are those necessary for a child's well-being? When a person is child itself, should we give such supplements?
That is a very good question. Many of the parents, they are on already multivitamin supplements and food supplements from other physicians, or sometimes the parents themselves ask. They think that by giving vitamins or supplements, my child will become like a Superman. It's not like that. Always remember the child is nature's gift, and go back to nature when you are dealing with a child. That is the first thing I always explain my patients, because food is a very good source of all type of nutrition. Why do you need to give supplements? No, supplements are needed when there is there is a specific deficiency, like there is a calcium deficiency, there is an iron deficiency, there is a vitamin D deficiency. These things we can diagnose by test only when there are some symptoms. But just as a rule, as a general, if you want to give multivitamins or some protein supplements, it is not advisable for the child. Better you give the vitamins which are present in the food, like fruits and vegetables. They contain so many vitamins. There are also sort of green leafy vegetables which contain iron. Many things are there which I can explain you in detail later. So these food items, food things are the first thing you should take. And the commonest problem I encounter nowadays from the parents or the mothers are that my child is not eating, but I feel that just remember, or just go back in time when we were young. Our mothers never used to give us multivitamin. Did we not grow up well?
Yes.
But the thing is that nowadays also the mothers also want to take the easy way out. Not all, but I've come across such things in my practice. We have to, child is like a plant. We have to nurture the child. How you do with a plant? Do you give some direct something chemicals and the plant will grow up fast? It doesn't happen that way. It takes its time. So you have to nurture. You have to go after the child in the initial years, form certain habits, and that way you can ensure that the child gets proper multivitamins and supplements. No need to give these things unless required, unless the doctor advises, and that also is absolutely necessary. Don't just go for multivitamin tablets or syrups.
Doctor, when you told about deficiencies, if there's a deficiency we have to take, doctor might recommend something very common is vitamin D deficiency.
Yes.
How to tackle that issue other than taking supplements?
Yeah. See, vitamin D, there are two major sources of vitamin D, although other things are there very less amount. Most abundant sources, as we all know, is sunlight. Now, the thing in the Gulf countries especially, because of the climatic conditions, like half the year we are having so much of heat and summer, we don't go outdoors mainly. And our kids also, and especially nowadays in the pandemic times, we are more so in the house. The kids are not going to school, they are not going to the playgrounds, they are not going to the parks. All these things are affecting the child, especially the vitamin D levels. So if you don't want to give supplement, then you have to go for natural source sunlight. How to give, there are several studies and several recommendations. But I have gone through many studies, and what I have found out, that majority of the scientists and researchers have recommended that around 45 to 50 minutes daily, at least 6 times a week, of exposure to sunlight. And how to expose, you have to keep your arms open right from below the elbow, and the face should be open, and let the child go out in the sunlight, in the park, let him play. Don't make it conscious that he's getting vitamin. Just let him go out in the open. So these things will help the child will get, and will ensure the child gets vitamin D. Another important aspect is the time. What time we have to give the sunlight? That is there is a lot of confusion in this. Some advise in the morning, some advise in the afternoon, but most of the studies advise that from 10 a.m. to 3 p.m. in the afternoon, where the sun is at the peak. it is the best time to get vitamin D.
Okay.
So not the early morning sun, which is a cool sun. That will not give you maximum vitamin D. Maximum you'll get in. So in the at least in the winter months, I can advise, at least in the winter months, take your child out in the park. Also ensuring all the pandemic protocols which are in place at present. We need to follow the guidelines, but if possible, wherever possible, or on your building terrace, if it is possible, where the child is not exposed to other people, but at least you can take the child out in the sunlight and ensure that the child gets proper vitamin D. Second is the food. Food source, only major source is fish. That too, the child has to, eat a large quantity, around 500 grams to 750 grams, which is not possible. Almost every other day, it is not possible. Not per week, but every other day to eat a large quantity of fish is not possible practically. So as such, the vitamin D major source remains the sunlight. Or if you are not getting enough exposure, then you have to take the supplements. That's the only way out.
Thank you, doctor. So we already heard of many aspects regarding a child's health. We have many more to discuss, especially during this COVID times. We have many questions in our mind regarding how to handle a child's health, how to take care of it. So please stay tuned. We shall be back after a very short break in Al-HILAL Health World. Welcome back. You're watching BMC Global Live Al-HILAL Health World. Today's topic is child health, and we have with us Dr. Abuzer Surka, and he answered to most of our questions regarding different allergies in children. Hope all those answers were very helpful for you viewers. So please share this episode to your friends. We have many more questions to go. Now we'll be taking up a few questions from our viewers, a few questions that have been repeatedly asked. Very important questions. So, doctor, let me move on to the questions.
Sure.
Doctor, during COVID times, my child has become cranky, moody, and not eating well. Yeah. That is the first question. So, what could be the reason, how to tackle it?
Yes, this is a very common problem nowadays occurring in children. Yes. Especially their life has been turned upside down because of the COVID pandemic. True. Since past almost 15-16 months, they are in the house restricted. Their life, normal life has been completely I'm sort of disturbed because they're not going to school, they're not meeting their friends, they're not going out to play. So all these things, affects their mental health also. Yes. We need to keep that in mind. Parents have to be very much patient with them, give them extra care and try to divert their attention to happier things. Child is cranky, why? Because child is irritated. Child is not happy. When we are not happy, what do? We sometimes become cranky also. So if the child is not eating well, don't scold the child. I would advise the parents, don't scold the child, don't force the child. Try to try to create a happier environment for the child in the house itself. True. Keeping in mind all the COVID-19 restrictions and protocols, we need to make the child feel happy. Sometimes I would give some day-to-day tips, like very common things. You can make a Zoom call with the friends of the child. And especially you can make a group of mothers and have the same eating time or lunch time or dinner time for the kids. Yes. So because of that, they see each other. They will feel more like eating. They will feel happier. You can keep some competition of eating of sorts. Like what have you made? I have made this for my child, and this will again ignite the interest. Yes. Why the child is cranky and like fussy and all that? Because the child has lost the interest. Child is feeling like I am not able to live my normal life, and the children don't express their feelings directly by words. Most of the time, they express by behavior. Yes. So we have to do this. We have to keep in mind the mental health of the child, and you can easily solve the problem. You have to become a child with a child. That's what I always tell, and True. What I do also in my clinic. Sometimes kids, we have to become kids with them, and then the problem immediately vanishes.
Doctor, those are very interesting tips. Actually, for the first time, I'm hearing such interesting tips. Definitely, parents can use those. And doctor, let me add on a question. Sure. For a little bit more older children, the teenage, for those age category, there has been a psychological impact after this COVID has begun. the distance from friends, and probably they were more comfortable with friends. Now they can't meet them in person. So how to handle bigger children?
See, even your question contains the answer here, no? Why, as we said that the older children, teenage children, they are missing their friends,
Yes.
right?
Yes.
So what is the solution? Become a friend for a child,
That is true.
right? In a house, don't create a distance or don't become a boss for a child. Just become a friend for a child. Try to involve the child in certain discussions. See, each age group of a child has their own set of problems, their own set of behavior, their own set of ways to tackle them. So when we have a teenage child in the house, boy or girl, depending upon their choices, depending upon their interest, try to mingle more with them. See, the pandemic has also given us another opportunity. You should take it positively. We are working from home or we are at home. So we get to spend more time with our kids, which we are not getting before. So make good use of the time. Don't fret and don't complain that this thing, parents should try to develop a more strong bonding, and especially this age group of, the teenage children. It's very important to create a strong bond with them so that they can share their problems with you, and you have to always tackle them as a friend. Don't scold them even if they make mistake or they are doing something wrong, because this age group will not be controlled by scolding. Always remember that. This age group, we have to become their friend. That is the only way to reach their hearts, and that way only they can open up with you, and it will be easier to solve your problems. They will become much more happy. The basic thing I feel in life, apart from being a doctor, as a human being, I also feel that to be happy in life is the most important thing.
Yes.
Then only your problems will, see, problems everybody has in life. No, everybody has. But we need to know how to tackle these problems. And this the most easiest way is create a happy environment surrounding you, your children, or a child. Make the child, get a child involved in certain things, get certain online activities. They are missing their friends. Again, as I told you before, make a daily or a sort of twice weekly, make a Zoom call with other friends. Find out what they are doing, what your child can do, and this way, the child becomes more happy and everything will become much better.
Doctor, let's move on to another aspect. Another question from a viewer. My daughter is 15 years old. Should I give her the coronavirus vaccination? Is the question. The main reason the question came up is I am afraid about the side effects after watching videos on social media, and too much panic and confusion has been created.
So regarding the question about vaccination, it's a very important question. Yes. But here, first of all, I would like to request the parents to leave the social media universities. Please don't follow them. They are not reliable always. Yes. Secondly, see, vaccination is very, very important for everyone. And in this fight against COVID-19, we should support the Bahrain government, as the Bahrain government is doing a very good and commendable job. True. Trying to vaccinate us all. Regarding the vaccination for kids, see, all the vaccines in Bahrain which have been approved for kids have been approved internationally. They have undergone strict studies and research. Yes. So instead of fearing about the side effects, which are very, very small in number, we should fear the consequences of COVID-19. We should support the government in its fight against COVID. We should also take part in this, and we should vaccinate all our eligible children. They should be completely vaccinated as per the government protocols and guidelines. Do not fall prey to this WhatsApp and other social media messages. And always, you can ask your doctor if you have any doubts, of course. Yes. Because we follow the scientific evidence, and child health is, or any health in particular, is always evidence based. We don't follow any sort of assumptions or theories. So again, my answer is yes, you should get vaccinated. Get your kids vaccinated. Whoever are eligible, get them vaccinated as soon as possible. Because another important thing is we want to get our children back to normal life. Yes. Don't we want that? How they can get back to normal life if we are not going to protect them? So please do that, and yes, please don't worry.
That was certainly a reminder once again for everyone who is eligible to take up the vaccinations as soon as possible. Yes. Actually. Doctor, the next question that has come up is, due to online education, my son aged 9 years frequently complains of headache and itching in the eyes. This is a complaint for most children,
yes.
not just for one particular child. So, yes, how to tackle these problems?
Sure. See, this is a very bad fallout of this online education, because the kids have started spending much more time online in front of computers or tablets. Yes. Or mobile phones. So there are certain tips I would like to give. already they are having sufficient time online. So after the school studies, try to restrict the time with the phones or tablets as much as possible. Try to give them, like if possible, take them to the park or give them some natural, the surroundings. Secondly, take a break in between the studies. Every 1 hour, at least take 5-10 minutes break, if wherever possible, so that child will not get any strain on the eyes. Thirdly, if the problem is too much troublesome, then you should consult the ophthalmologist so that he can evaluate the child properly. Sometimes it may be due to some errors of refraction. Most commonly, it is due to dry eyes. Eyes become dry, secretions dry up because of constant exposure to these gadgets. So, keeping all this in mind, we need to act accordingly. First of all, we have to reduce the time with these gadgets, reduce the exposure of the eyes, and then wherever required medications are needed, consult a doctor and take them.
Doctor, along with the online education, another problem that has come up is laziness among the children.
Yes.
No activity.
Yes, true.
Lack of activity. How to tackle such issues? There will be some other health problems that may come up in future because of the lack of activity now.
Of course. See, always, physical activity is very important and important part of our life. We cannot be like stagnant or sort of lethargic all the time. So, but in COVID times, we are faced with these difficulties. So you have to substitute the school times, like school physical education and school sports time with certain things at home. Don't let them sit in front of the television or tablet all the time. Once their studies are over and they have taken adequate rest, take them out with you nearby in your neighborhood, following all the COVID-19 protocols. Take them out, do some basic activities like cycling, running, walking with the kids. As I told before also in some of my questions, sometimes we have to become kids with the kids. If the kids are younger, we have to go with them and play with them and do all the activities with them. Because we are also worried we cannot let the kids mingle with other kids. There is another problem we don't know. So we have to become a kid with them. In this type of situation, we have to act accordingly. Because we have to avoid groups, we have to avoid get-togethers. But in our own family, in our family members, we can go. The mother or the father can go out with the child, play with the child. If the child is older enough, child can go on his own. He can have some activities, some running, jogging. See, all this will keep your body keep your body toned up, keep your body fit, and it will not cause so many pains and aches. Otherwise, if you're all day in the house and in front of the air condition, you are going to get muscle pains, you are going to get body aches, and also it affects the health. And most important is vitamin D exposure. We will not get enough. Also other things, the child may get all the eating junk food in the house. It may also add up to the cholesterol in the blood in the child, and it may cause problems later on. So keeping this in mind, physical activity is an integral part of our, should be an integral part of our daily routine. At least take out 1 hour, 1.5 hour daily with your child for the physical activities.
Yes. Doctor, we covered many aspects of allergies and during COVID times how to handle children. Could you just sum up this episode so that we can move ahead?
Sure.
Yes.
It was really a great pleasure answering all the questions. See, we talked today first of all about childhood allergies.
Yes.
In short, there are 4 types of childhood allergies. One which comes in the newborn period, in the first 6 months, that is called cow's milk protein allergy, which needs to be diagnosed as early as possible because it can cause several feeding problems in the child. Then comes after 6 months of age, there comes all different types of food allergies. For that also we need to diagnose because we need to be sure what type of food the child can tolerate, what we can give to the child. Then comes the skin allergies, which are seen in all age groups, right from newborn to the adulthood. So for that we need to diagnose what type of skin allergy. There are different types of skin allergies. Some may be some may be only for a short period of time. Some may be for a longer period. Some may even become worse over a period of years. So don't take them lightly. Consult a doctor and take the opinion, and they will advise you accordingly. And last is the respiratory allergies, which is comes as frequent cough, cold and breathlessness, which may over a period of time may even progress to bronchial asthma. So we need to treat them as soon as possible. And then we talked about the different types of nutritional problems, how to deal with them, and during the COVID-19 pandemic especially. In that, one very important message to take home is get your child who is eligible for vaccination. Take your child to the center and get them vaccinated as soon as possible. Secondly, look into the mental health of the child and also the health of the eyes of the child and the physical activity. These things we have to keep in mind, and we have to ensure the overall well-being of the child during these tough times.
Yes. Thank you very much, doctor, for answering many of our questions.
My pleasure always.
Definitely, about child's health, questions will never end, queries will never end, definitely. So this episode does not end here. We will have a continuation of this episode in the next episode as well, with the same topic and with the same doctor. So until we meet next week, same day, Tuesday, 8 p.m. This is Marina Francis signing off. Once again, reiterating what doctor said, happiness is what we require right now. So stay happy and spread happiness. Good night.